EBBA-II trial is a trial which includes newly diagnosed breast cancer patients ahead of surgery, and after surgery they are randomized either to a control group with standard regime or to an intervention group with physical activity performed in groups twice a week, 120 minutes altogether, and additional home activity. And then we follow them throughout chemo and endocrine treatment all through the first year after surgery, and then take all the measurements again at 6 and 12 months. And what we observe, the main findings, is the following. When it comes to the cardiovascular function and capacity, all type of patients, independent of being on chemotherapy or not having chemotherapy or only radiation, do have an effect and use of being active. In fact, it's incredible how consistent the results are. And even those who are on heavy treatment with chemotherapy have an important effect of being in the active group. In fact, it's like that those who are in the chemotherapy group have a decrease of 17% of VO2 max, cardiovascular function, during treatment. In the intervention group, only 7%, and they increase the level in the intervention after treatment up to nearly normal, while those in the control arm is still below. This is the first study, to my knowledge, that have assessed cardiovascular function ahead of surgery, and also who have taken all sampling ahead of surgery, and then also randomized them to a control arm and exercise arm, in where the adherence being in the study is in fact 90%, which is very high. So loss to follow-up is nearly very, very low. So I think that's the loss of follow-up, the adherence to the study, and the pre-assessment before surgery. In addition to all that, we also have taken sampling, like fecal sampling. We can look at the gut microbiota, we can look at all different types of quality of life. So it's from both nutritional part to quality of life to genes. We can look on that because we're taking everything ahead of surgery and then follow them throughout. And that's unique. The high rate of adherence is a few things which is important, and that's enthusiastic group of physicians which have talked, phoned, and followed them throughout the first year. So in fact, the patients feel they are as a group, even if they are in the control group. And in fact, one of the patients, and the user involvement here is large, they said, I can be on phone, so you can get her number and you can phone her and she will be there. Because they feel that this has been such an important study to come into. So there has been about identity. They have made a mascot, EBBA-II mascot, they have made songs, they feel and they learn a lot, I think, from each other and also being there. So it's both support and also then having something positive. They feel healthy in a way, in spite of that they've been gone through breast cancer surgery. Those who go through re-surgery, because a lot of people have a breast conserving surgery here in my cohort. Those women who go to re-operation because it's not free resection, they seems to have problem in coming into that. And in fact, that's nearly half of the patients, and that makes a difference between control and intervention arm. Cardiovascular morbidity and is so important for our breast cancer patients that I think that it's time to have physical activity, physical function as a main interest for all clinicians dealing with breast cancer patients. If you take a breast cancer patient, and if he's 55, 56 years old, and compare her life expectancy with the one who's not been diagnosed with breast cancer, not treated with that, she will have on average from 5 to 7 years less in spite of being cured. And most of these reasons is due to cardiovascular disease, which is a competing mortality reason for breast cancer patients. And we think that we are doing better and better, and we are, of course, but you know, the long-lasting side effects should be taken care of, because people survive, but we want them to survive with quality of life and also to have the same life expectancy.